Top of the morning, Dan and Amy. And the other week we talked to our friend and local mortgage expert, David Hochberg, about Fannie and Freddie and HUD and what's being done to protect American homeowners from foreclosure, what's being done to protect American landlords from foreclosure, frankly. Foreclosure eviction, but foreclosure for the landlord in multifamily units where you have renters, for example. For more on this topic, we're pleased to be joined by Dr. Ben Carson. He, of course, is the United States Secretary of the Housing and Urban Development Department Agency. Dr. Carson, thanks for joining us. Appreciate it.
Good morning. Good to be with you.
Good morning. Only if we could just use the gifted hands on the housing market on COVID, boy, that would be a lot easier, but I know we can't. Talk about what HUD is doing with respect to 8.5 million single-family homeowners with mortgages or reverse mortgages insured by the FHA.
Yeah, well, of course, the last thing somebody should be worried about is losing their home. In most cases, their most valuable investment, and so that's why we moved so quickly early on to bring forbearance into play and moratoriums on foreclosures that were in process or that would occur over the next 60-day period. And that can be reinitiated if necessary after that 60-day period. In addition to that, a lot of people were concerned that, okay, maybe 3 months of mortgages I don't have to pay, but then on the fourth month I got to pay all that back. I won't have that money. Well, what we've done is create a program, partial claim program, whereby we can amalgamate all of those payments into a sub-mortgage, which is tacked onto the end of the primary forward mortgage. Interest-free, by the way, and does not have to be paid until after the primary mortgage is paid.
And when it comes to families assisted by public housing authorities, how is that dynamic working between the federal and the local?
Well, there's the moratorium on evictions, and we've worked with all the public housing authorities, all 3,300 of them, to make sure that they know what their various options are, including using some of their reserve funding. And, we are very cognizant of the fact that, this is sort of a domino effect. It's not just the renter who's in danger, but obviously the landlords have mortgages that they have to pay.
Right.
Also, the servicers have fees that they have to pass through to the investors. So, that's why we've created the pass-through assistance program, so that, Ginnie Mae, who is involved with mortgage-backed securities, can advance money that can then be used for the investors, so that we really kind of try to take care of everybody along the whole spectrum. And I know that FHFA and the GSEs are considering such a thing also.
Ginnie Mae has the capacity to be stood up to provide that kind of backstop?
As long as we don't go for, an extended period of time, we can do that, yes.
Well, how much time do we have?
We certainly would not want to be, going on for 6 months or a year doing that. And that's why we're reintroducing people into the workplace again, which is a very smart thing to do. As I've said before, if we wait till every vestige of the virus is gone, our economy will be gone also. The infrastructure of our economy will be gone. So, we have to be smart about this, and we have to balance off, the risk and benefits of, having a society that is completely sheltered versus one in which we safely and logically reintroduce people back into the workplace, understanding, how the virus is transmitted, understanding personal hygiene, social distancing. And if we do it that way, I think we'll be fine. Also recognize we have 50 different laboratories with 50 states, and people are opening up at different times and in different ways. And by observing what's going on I think if we see something that isn't working, we can make sure that we very quickly utilize that information in subsequent places.
As a medical doctor yourself, how would you rate the advice and counsel that the president has gotten from Doctors Birx and Fauci?
I would say it's been outstanding. It's been very good, and of course, any advice that they give in the current environment is going to be criticized. We understand that, but what we have to do is use facts and use science, and we learn things. In the beginning, no one had any idea that 25 to 50% of people who carried the virus would be completely asymptomatic, and hence the recommendations came that the average person didn't need to wear a mask. Well, of course, we've learned, and now we want to protect the people around us. So if you're asymptomatic and you're out in public, you need to have a mask because you could be spreading the virus. We learn these things, and obviously we add those to the armamentarium, and that's going to help us.
Secretary Carson, how important do you think antibody testing is going to be in trying to get us, back up and running as a country?
I think it's going to obviously add a lot of comfort to what we do. We could probably get the country back going even without it, but having it obviously is a big advantage and it helps us to speed the process along.
And also, just in terms of things we've learned along the way, really the infrastructure that we had, the way we had it set up, that needs to be altered permanently going forward, doesn't it?
Well, there's a lot of things I think that are going to be altered because of what happened. I don't think things will ever go back to being exactly the way they were before. But for one thing, we've learned an incredible amount about teleworking and who needs to be physically present, who doesn't need to be physically present, how efficiently their work can be done in other different ways. As technology advances, particularly things like virtual reality, it will be very easy to put on a headset and be in the conference room with all your colleagues or to be doing other things. So I think that's going to change a whole lot of things, including transportation and transportation needs.
When just again putting your hat on as a medical professional, not your HUD hat, when you hear of hospitals, Wall Street Journal reporting the other day, hospitals that are on the verge of bankruptcy, furloughs, pay cuts, and firings of medical professionals who are otherwise being lauded as heroes, rightly so, with the frontline defense against infection and treatment. Does it concern you that the government doesn't quite have this right in terms of scrambling at every level, in terms of scrambling all resources for COVID-19 at the expense not just of other patients and their needs, but also of the business model for hospitals?
Well, I think it probably was necessary to stop a lot of the elective procedures that were going on at hospitals so that we could have the personal protective equipment that was necessary in order to deal with the crisis. But as the crisis is starting to fade, bringing back elective surgery and bringing back all kinds of elective procedures and filling those beds again will be absolutely critical. And that is part of phase one, and that is starting to happen already. So I think we will be in time to save those places. And also, as you know, as part of the CARES Act, a significant amount of money has been provided in order to sustain the hospitals. So, we recognize that we have a terrific medical system here, and there's no way we're going to let it die.
Yeah, $2 billion of that is going to go to construct medical facilities, correct?
Yes, there'll be a lot of money going for construction and maintenance. Medical facilities.
One other agency issue, going back to HUD now, because this is important in terms of state management, local implementation when it comes to things like testing. What HUD is doing with respect to CDBG grantees, Community Development Block Grant Program, explain that.
Well, in the first tranche of over $3 billion, $2 billion of that is dedicated to CDBG type programs. And there's a lot more flexibility in terms of how that funding can be used. But primarily, it's supposed to be directed toward those things that help us to combat, the COVID-19 crisis. So, people will be using it in different ways. Some of it will be done for construction of treatment and testing facilities. Some of it will be used to support industries that produce medical equipment. Some of it for convalescence. There's a whole variety of different ways that it can be used.
He is Dr. Ben Carson, the United States Secretary of Housing and Urban Development. Dr. Ben Carson, thanks for joining us. We appreciate it.
It has been a pleasure. Thank you.
Yes, God bless. And he joined us on our turnkey.pro answer line.
Before you see it on TV, share it on Facebook, or read about it in the paper, hear it here first. This is Chicago's Morning Answer on AM 560. The Answer.
Right now, nobody is going to want to come into your building unless you prove it's safe. Nobody. That's reality. What are you going to do about it?
This is Jack at Ecstatic Clean. We are part of the coronavirus solution. We test commercial building space for germs and viruses and give you immediate results.
Immediate results?
Yes, immediate results. Microbial contamination detection and disinfection. It's all we do.
So you test for virus and bacteria. What's next?
We disinfect contaminated surfaces. Then we test again to make sure the threat is gone.